Part 2 of the tutorial will discuss something about the abnormal ECG and certain disease-specific ECGs such as coronary artery disease, cardiomyopathies, and arrhythmias. As we know that it's the most commonly employed test in medicine, and many of us who order ECG actually cannot interpret it correctly, and we do not even are aware of this inadequacy. Sometimes we can transmit incorrect information as well, which may lead to disaster. So I have made a module, the aim of which is to provide a comprehensive guide to correctly interpret normal ECG in a stepwise and systematic manner, to make the learners aware of normal variants and avoid wrong interpretation so that unnecessary treatment is not administered, and to practice a structured ECG reporting protocol which includes the patient details and the various sequential reporting of rate, rhythm, QRS axis, various waveforms, various intervals, followed by any other significant finding. What are the practical issues when you are interpreting a ECG? First of all, remember that the clinical scenario and the presenting complaints of the patient are very, very important to correlate with the ECG finding. Certain times in acute MI, say, initial ECG may be absolutely normal, but if the clinical scenario demands, the patient should be kept under observation and serial ECG should be done to come at a conclusion. Number two, do not have fear of incorrect diagnosis. Many times we get bogged down that what if I go wrong? Do not be afraid of that. And I'm telling